Hi, I'm Dr. Edwin Williams here to answer your questions about facial rejuvenation surgery as a specialist and a facelift specialist. One of the questions I'm always asked is, what is the best way to treat a sagging neck in facial rejuvenation? Now, let me just explain what we talk about a sagging neck. It's typically this tissue right here. And a lot of folks, as they get older, don't really see it, but you can start to see it in a three-way mirror. You know, when you go through Macy's, for example, and you catch a look and in the mirror, and that's something that really bothers individuals, men and women, and even younger individuals, people in their 30s and 40s. So how do you treat a sagging neck? Well, let me first explain what is a sagging neck. One is that there is some fatty tissue in the neck which is somewhat genetically predisposed and based on weight. So there are some individuals that just have a genetic predisposition to putting weight there and or fatty tissue, and it doesn't really matter whether they lose weight or gain weight, they still end up with the predisposition of that. And there's also skin and loss of elasticity. For example, as we get older and we lose some of that elasticity of our soft tissue envelope and things stretch out, there's a propensity to see more tissue in that area and have what we call double chin or a sagging neck. Now, what are the treatment options? In a younger patient, it's a little different than an older patient. A younger patient, if you think about it, has more elasticity and more bounce back. So typically the patient who has a little fatty tissue in here and it bothers them and they're self-conscious and they're under the age of 40, and I just arbitrarily draw the line at the age of 40, can be better served with cool sculpting, perhaps, liposuction or Kybella. Kybella is an injectable that works very, very effectively there. Cool sculpting is a freezing device for fatty tissue, and even some liposuction for people who have a bit more. And I don't want to go into all the advantages and disadvantages because they are in a different fireside chat, but suffice it to say, younger individuals with those type of modalities have some bounce back and recoil, and it's often all you need to do. Older patients, a little more involved. As you start to get over the 42, 43, maybe 48, 50 year age, there is enough soft tissue in sagging neck that really needs to be tucked up with a lower face or neck lift. And we typically do that in conjunction with liposuction. In my particular practice, we have a lot of patients that have a heavy neck. And for those who have a lot going on there, even though we do liposuction, the best approach that I have found in 25 years of doing lifting surgery is what I refer to as a deep plane facelift. And again, the purpose of this fireside chat is not to talk about deep plane facelift, and we have that in another discussion, but suffice it to say, in the older individual, again, mid-40s and on, who has enough tissue in their neck, the best way to treat a sagging neck and fatty tissue is with a deep plane lift and some liposuction. So I hope that answers your questions on how is the best method to treat a sagging neck to achieve the most natural results in lifting surgery. So thank you for taking the time to watch.